Hi, my name is Charlie Macdonald. This is my CSB346 video presentation on experiential learning and clinical debriefing. The concept of an emergency management triad involving training, experience, and now education has expanded the job of a paramedic to a more academic profession. Simply training skills and behaviors without an academic background that includes understanding of physiology, anatomical structures, and pathology is not as effective as nurturing in-depth knowledge with experience. The idea of experiential learning involves the consolidation of knowledge through the transformation of the education with experience. A vital step in experience is a reflection on the experience in the form of clinical debriefing, which is detailed discussion of what went right, what went wrong, and areas you're not sure about to reinforce the knowledge. This reflection is essential and allows for the experience to be analyzed, and critical thinking can be used to problem solve real-life issues that are encountered. This is an active form of learning that assigns the responsibility of learning to the learner. It is a facilitated and guided reflection embedded within the process of experiential learning. Its main goal is to build improved behaviors within practitioners in their future practice. Education involves a university-level bachelor's degree within Queensland. The profession of paramedicine in Australia is transitioning in scope in education, moving away from a post-employment centric model involving on-the-job training towards a pre-employment model involving a bachelor's degree. Here in Brisbane at QUT enables all components of the emergency management triad. It integrates practical and tutorial work to familiarise students with equipment and practice the skills they'll need in the career of a paramedic. Through the use of simulations, students can train their assessment skills and grow confidence in communication and the language involved in the job. Critically, QUT is the first of its kind in the state to include 18 weeks of experience in practical work with QAS for its students. This allows for sufficient competency and work readiness in transitioning from university to the workforce. This is where the fruit of learning and training is played out, with on-road work lending both experience through observation but also mentorship with fully qualified paramedics, where further learning is acquired through discussion, reflection, and debriefing. Clinical debriefing in this context of a student paramedic on road, they encounter experiences, and this debriefing is most successful immediately following a case. It allows for a decompression and integration of the experience into their knowledge base, and provides stimuli for conversation to expand on that knowledge base with their mentors. Discussion and review enable better preparation for managing those situations in the future when they arise in your career. Helpful and supporting guidance involves going through what was missed and the explanation of alterations that can be made for future greater practice. For example, the 2010 American Heart Association officially recommended the use of debriefing in their resuscitation guidelines immediately following cardiopulmonary resuscitation events in order to significantly improve clinical management. This is due to debriefing programs demonstrating less time and delay to first compression, improved neurological outcomes, and improved rates for return of spontaneous circulation in later clinical resuscitation events, amongst others. Further evidence for clinical debriefing is advocated across different fields, but is predominantly notable for its involvement in critical thinking. Critical thinking includes the skills of making inferences based on deductive reasoning supported by a basis of knowledge. It involves judging and evaluating, and habits such as open-mindedness and willingness to consider diverse viewpoints to solve problems. Broadening your depth of knowledge can be achieved through critical thinking within a debriefing, as well as the discussion that leads to logical arguments. Whether it be group reflection or one-on-one with a mentor, communication after intense episodes of clinical management is a vital aspect of emergency care in order to improve future performance, and debriefing is an important teaching strategy for experiential learning. Experiential learning is a product of reflection upon experience, and the nature of reflection is significant to the process of learning. In my experience, positive feedback, where my mentors have highlighted the things that I did well, then expanded into areas where I can improve on my practice next time, have been more helpful to learning than pointing out I did this wrong or that wrong in the moment. A major advantage to experiential learning is the value employers hold in real-life experience for university students. They prepare them for the transition to a confident clinician, capable of decision-making in a multitude of stressful environments they've now witnessed before their own eyes with experience. Experiential learning is particularly significant for future paramedics, as the experience allows for observational learning in a variety of situations that boosts situational awareness and understanding everything going on around you before implementing action. A more holistic approach to patient care for a more rounded learning is important for population groups. For example, an elderly age group are more likely to suffer from a spectrum of issues beyond physical presentation. It's essential that graduate paramedics have an awareness and understanding for appropriate recognition and assessment of those patients. Younger adults tend to lack life experience and interactions with diverse communities. They require experience to be integrated with their academic and classroom learning. For me personally, communication is the biggest skill I've developed from my experience on road that I wasn't able to train for or learn for at university assessing mannequins. These communication skills are critical for developing rapport that increases the share of information, allowing for better management for the patient and overall patient outcomes and satisfaction. Learning from mistakes and failures in a safe environment should be met with support. For the initiative to put oneself out there to learn. Every misstep is an opportunity to demonstrate a better method of doing things the next time. Developing confidence in my clinical knowledge and communication skills has led me to a greater self-awareness of myself, and long periods of time spent on road experiencing impressive, intelligent, and caring paramedics has passed down a range of behaviours that I have begun to adapt to improve how I connect with the community. The use of metacognition, which is thinking about thinking, allows the student to analyze their own thought patterns and how they operate to recognize why we do things, and it can be applied to finding gaps in their systematic assessments. With a friendly, goal-driven approach, meaningful reflection in the form of debriefing, after each case can expand critical thinking skills, which is both a valuable skill on its own for paramedics, but can also be applied to improve how each case can be run again in the future. Experiential learning stimulates an understanding of complete patient care. It connects the classroom to the real world to create new paramedics with a full range of education due to the wealth of knowledge provided by experience. Over my last couple of weeks of placement, we've been using every case, no matter how small, to clinically debrief. And this comes from things such as cannulation techniques and sliding veins and what I can do next time, from our bigger jobs like a STEMI that we've had recently, or a large vessel occlusion stroke. So my mentors are able to not stop me during my assessment of my process, not point out anything wrong, but afterwards provide feedback not just to me as a student but to each other in really positive discussion to enable future better care for all of us. And it's really been a privilege to be a part of it. I feel like I'm learning a lot. So I'm allowing my current knowledge base to be applied to every case. I'm gaining the experience of learning for myself, and then in a safe but also a positive environment, having discussion that's leading to further discussion on things like pathophysiology or even just simple anatomy, things like blood pressure, different differential diagnosis, things like clot formation and atrial fibrillation. Even the ECGs, we were just getting out life in the fast lane on every little noticeable change, whether it be some signs of ischemia or peak T waves or ventricular hypertrophy. Yeah, it's been extremely motivating and a place where you can speak your mind, and it's improving your communication skills.